Mitigation guidelines issued by the CDC, April 2009, include social distancing strategies to reduce contact between people. Closing schools. Canceling public gatherings. Planning for liberal work-leave policies. Teleworking strategies. Voluntary isolation of cases. Voluntary quarantine of household contacts. Pandemic Flu Family Guide to Preparations. A flu pandemic is a global outbreak of influenza that occurs when a new flu virus appears, to which people have little or no immunity. Pandemic flu spreads easily from person to person and can cause serious illness because people do not have immunity to the new virus. Seasonal flu outbreaks are caused by viruses to which people have already been exposed. Flu shots are available to help prevent widespread illness, and effects on society are less severe. It is difficult to predict accurately when influenza pandemics will occur, how severe they will be, or how long they will last. A pandemic may come and go in waves, each of which can last for months at a time. Everyday life could be disrupted due to people in communities across the country becoming ill at the same time. These disruptions could include everything from school and business closings to interruption of basic services such as public transportation and health care. An especially severe influenza pandemic could lead to high levels of illness, death, social disruption, and economic loss. The effects of a pandemic can be lessened, however, if preparations are made ahead of time. As you plan, it is important to think about the challenges you might face, particularly if a pandemic is severe. It may take time to find the answers to these challenges. The following are some situations that could be caused by a severe pandemic and possible ways to address them. Social disruption may be widespread. Plan for the possibility that usual services may be disrupted. Such services could include those provided by hospitals and other healthcare facilities, banks, stores, restaurants, government offices, and post offices. Prepare backup plans in case public gatherings, such as volunteer meetings and worship services, are canceled. Consider how to care for people with special needs in case the services they rely on are not available. being able to work may be difficult or impossible. Find out if you can work from home. Ask your employer how business will continue during a pandemic. Plan for the possible reduction or loss of income if you are unable to work or your place of employment is closed. Check with your employer about leave policies. Schools may be closed for an extended period of time. Help schools plan for pandemic influenza. Talk to the school nurse or health center staff. Talk to your teachers, administrators, and parent-teacher organizations. Plan home learning activities and exercises. Have materials such as books on hand. Plan recreational activities that your children can do at home. Consider child care needs. Transportation services may be disrupted. Think about how you can rely less on public transportation during a pandemic. For example, store food and other essential supplies so you make fewer trips to the store. Prepare backup plans for taking care of loved ones who are far away. Consider other ways to get to work, or, if you can, work at home.